Hello everyone, in today's Explain Why series, we are going to understand a concept, that is why sudden lying to standing. Suppose if somebody is lying for a very long time and immediately they stand up. What can happen is sometimes there is fainting in a person. This usually does not happen in many of us, but in some people when they sudden immediately they will have some giddiness or faintness feeling. So why does it happen is, it happens because whenever a person is lying to standing, there is venous pulling. The blood supply in the venous system, they get pulled towards the lower limbs because of the gravity. So if the blood accumulates in the lower limb, the blood that is coming back inside the heart, that is inside the right atrium and the right ventricle, it is going to come down. So what is going to happen? There is decreased central venous pressure. And because of this decreased central venous pressure, what is going to happen? There is decreased end diastolic volume on the right side, which in turn causes the decrease in end diastolic volume on the left side also. And when the heart is trying to pump in, so what will happen to the stroke volume? If the end diastolic volume itself is decreased, obviously the stroke volume is also going to be decreased. And if there is a huge decrease in the stroke volume, the blood supply to the brain will be compromised. And this will cause slight bit of faintness or unconsciousness in the person who is having this huge drop in the stroke volume or the blood pressure. But this does not happen usually in many of us because we have a wonderful system that prevents the fall in blood pressure and it corrects the blood pressure immediately. What is that system? It is nothing but the baroreceptors. Baroreceptors. So this defect, like the sudden fainting immediately after standing, can happen whenever there is a baroreceptor defect also. And this happens usually in old age people because their sympathetic system and parasympathetic system and their baroreceptor activity usually are reduced. Because of that, there is a huge decline in the amount of blood that is reaching the brain immediately on standing. And they will have a mild giddiness or they might faint also. So this is the reason why fainting happens whenever a person is suddenly standing from the lying down posture for a very long time. I hope it's clear. Thank you for watching the video. We'll see you in the next video. You can subscribe to the channel for many such videos. Thank you so much.